Good morning, and thank you so much for joining us today for our COVID-19 press briefing on the 19th of February, 2021. My name is Allie Triolo, and I am the Chief Communications Officer of Kern County. We have come together this morning with Chief Administrator Ryan Alsop, Director of Public Health Bryn Kerrigan, and Lead Epidemiologist Kim Hernandez. We want to be as transparent with you as possible when it comes to communicating about the COVID-19 vaccine, and we'll be sharing some important information with you this morning. First, I'd like to introduce Bryn.
Good morning. I'm going to start this morning by talking about our blueprint metrics. So Kern's metrics under the state's blueprint for a safer economy continue to trend towards the red tier. As reported by the state for Tuesday, February 16th, our testing rate was 329.6. Our unadjusted case rate was 24.6 per 100,000 people, and our adjusted case rate is 26.8 per 100,000 people. We have to get that case rate at 7 or below in order to move into the red tier. Our testing positivity rate was at 10.2%. We need to get that testing positivity rate below 8% to move into the red tier. And our health equity quartiles, the positivity rate within those census tracts was 13.5%, and we need to get that percentage below 8% to go into the red tier. Kern's case rate and daily cases are steadily decreasing from a high of 84.47 on December 18th and a high of 1,493 cases on December 9th, respectively. We believe that Kern County is on the tail end of the winter surge, but now is not the time to let our guards down. We are making great progress, and we need to continue in this direction to move into the red tier. We need to continue our COVID mitigation measures. We need to wear a mask. We need to physically distance. We need to wash our hands. And most importantly, when it's our turn, we need to get the vaccine. As of February 16th, Kern County has received 96,600 doses of the COVID-19 vaccine. According to the state's vaccine dashboard, as of this morning, 93,097 doses have been administered to Kern County residents. It's important to note that this is not the total number of vaccines administered in Kern County. This is solely the number of doses given to our residents. We know this number is understated because doses that Kern County Public Health has administered are still not reflected in the state's data. We continue to work with the state to correct these data issues. Kern is poised with an outpouring of community providers begging for vaccine allotment to vaccinate our community. We are capable of providing at least 45,000 shots every week. However, the supply of vaccines is not keeping pace with our capabilities and the demand in our community. We continue to advocate through all means possible for more vaccine and are hopeful our allotment will increase soon. As vaccines began to roll out, California implemented a COVID-19 vaccine plan that prioritized groups based on their risk within tiers and phases within those tiers. As we navigated through Phase 1A of the state's plan, tiers were opened as demand was met within the prior tier. On January 13th, the governor announced that individuals 65 years of age and older were eligible to receive the COVID-19 vaccine, in addition to those in Phase 1A of the vaccine schedule. This announcement changed the structure of the state's COVID-19 vaccine plan. Kern County immediately added 65 and older to the eligibility priority populations and continued to vaccinate healthcare workers. Since that directive, the state has released multiple different guidelines regarding vaccine eligibility. Until February 4th, the state's allocation guideline directed counties to prioritize vaccinating healthcare workers and those who are 65 and older, and when demand subsided in those groups, to move on to other priority groups. This direction appeared contradictory to the vaccination page on the state's website that indicated that all those groups in Phase 1B, which includes food and ag workers, educators, and emergency services workers, were currently eligible for vaccination. This contradictory information led to confusion statewide. On February 4th, the state updated the allocation guidelines specifying that based on available supply, healthcare workers, 65 and older populations, and sector populations including education, childcare, emergency services, and food and agriculture workers are or will be eligible for COVID-19 vaccines. This guidance continued to state that these priority populations would be eligible based on supply. In Kern County, there are an estimated 140,000 people who are healthcare workers or who are 65 years of age or older. While some other counties may have moved on to include other priority populations in their eligible groups, Kern County has only received enough vaccine to cover 35% of this population and therefore has not met the demand. Nationally, 8 out of 10 COVID-19 deaths are in adults 65 and older, and this population is at significantly higher risk for hospitalization and death than younger age groups. Specifically in Kern, 67.5% of our deaths are in adults that are 65 and older, and that age group only represents 11.6% of our population. This is our most vulnerable population, and the demand from this population group has yet to subside. At the rate we are receiving vaccine, it would take more than an additional 11 weeks to vaccinate this entire population. On February 17th, the state issued a memo that detailed their expectations for the allocation of vaccines starting next week, February 22nd. According to the memo, counties are now expected to allocate doses targeting 30% of vaccine to priority sectors included in Phase 1B, which are education and childcare, food and agriculture workers, and emergency services workers. And the 70% remaining of the vaccine is to be targeted to the age-based eligibility of those who are 65 and older. Because of this memo, we have informed all Kern County vaccination providers they can vaccinate in accordance with this new direction. This week, Adventist Health to Hatchb Valley launched a new mobile vaccination site with locations focused in eastern Kern. This site brings approximately 80 additional vaccines each day into our community that were not originally included in our county allotment. Since the launch on Monday, Adventist Health to Hatchb has administered 320 doses between Rosamond, Mojave, and Boron. To schedule an appointment for this site, please call 661-771-8400. The first week of March, we anticipate 3 additional vaccination sites to launch in Kern County. Each of these sites will provide up to 420 vaccinations per day, bringing an additional 1,280 doses into Kern County each day above our county allotment. These sites will be located in Rosamond, Wasco, and Arvin. Commencing next week, Kern County, along with a handful of other counties, will be included in the first wave of counties to be onboarded to the state's new third-party administrator, Blue Shield of California. Blue Shield will be responsible for the creation, management, and oversight of a statewide network of vaccine providers. Next week's transition moves the control of how much of the county's vaccine is allocated to each approved provider and who is eligible for vaccination from the county to the state. Additionally, Blue Shield will decide who is approved to provide vaccination in Kern County. Onboarding into the third-party administrators network also requires implementation of the state's MyTurn software. The MyTurn software is eventually going to be launched eventually going to be the statewide system used for eligibility and appointment scheduling, for vaccine allotment, and for vaccine data management. The state has required Kern County to implement MyTurn locally to be eligible to be a vaccine provider in the third-party administrators vaccine network. Thank you. Excuse me. Starting Sunday, February 21st at 9 a.m., Kern County residents will use My Turn to sign up for appointments at the mass vaccination site at the fairgrounds for first doses. At the time you make your first dose appointment, you will also make your second dose appointment. If you are not currently eligible or there are no open appointments, you can sign up to be notified when it is your turn. To make an appointment or to sign up for notifications, visit myturn.ca.gov or call the state's call center at 833-422-4255, Monday through Friday, 8 a.m. to 8 p.m., or Saturday and Sunday, 8 a.m. through 5 p.m. As we make this transition, we still need to schedule second doses for those who received their first doses and did not use My Turn for scheduling of your first dose appointment. If you received your first dose at the fairgrounds between February 3rd and February 20th, we will call you to make your second dose appointment. If you do not hear from us within 1 week of your second dose being due, please call our call center at 661-321-3000. What is important to note is the state's My Turn software now determines eligibility. Currently, My Turn only allows those that are 65 and older and healthcare workers to make an appointment for the vaccine, as the state system indicates they are the only currently eligible groups. This directly contradicts the state's memo from February 17th, which states that 30% of our doses should be administered to those in the Phase 1B, including educators, child care workers, emergency services, and food and agriculture workers. It is unknown when the state will update the eligibility criteria in their software. I'd like to turn it over to Ryan.
Good morning, ladies and gentlemen. We've been at this pandemic, dealing with it for a year now, and Ms. Kerrigan's comments to you, I think, reflects the complexities and difficulties, the enormity of what we're dealing with. And I want to thank the public, all of you, for your support and your patience over the last 12 months as our county has navigated this extraordinary and unprecedented event. I want to thank our health workers, public health workers who have been on the front line at our Department of Public Health, leading the public health response here in our community during this emergency. I want to send a thank you to our public safety, our first responders, our sheriff deputies, our fire personnel, our probation department personnel for the hard jobs that they have any given day and the work that they continue to do keeping people safe. Pandemic or not, they have a job to do and they do it well, and it is appreciated. I want to thank our county staff who continue to serve the public in critically important roles, the hundreds of employees in particular who are managing and staffing our mass vaccination effort out at the Kern County Fairgrounds as we speak, and they're out there each day. We also want to thank all of those organizations and people in our community who are not county employees that have offered their assistance in helping us manage through this, whether through providing workers or offerings of sites for testing or vaccination sites or through financial contributions. And even though they've not asked for this, and knowing them would likely tell me to not mention it at all, thank you to the Lee and Christina Jameson Foundation, who recently donated $10,000 that's going to be used to pay for transportation to our mass vaccination site at the Kern County Fairgrounds for those county residents who are elderly and or not able to get to that site on their own. This kind of gesture is pure Kern County, and it lifts us all, and it keeps us motivated to get the hard work done. Our Aging and Adult Services Department is spearheading this effort, working to ensure all residents who need a ride to the fairgrounds have one. More information on these services is going to be announced in the coming days, and people will be able to either call public health for information or get information on our website. Over 100,000 of our residents have contracted the virus over the last 12 months. And while the vast majority have either fully recovered or are currently isolated and recovering at home, at certain times, our hospitals and their staff have been taken to the brink. And to date, we've lost over 700 people in our community, unfortunately. The vast majority of people requiring hospitalization and nearly all deaths in our community related to COVID-19 are those 65 and up, a majority with severe and pre-existing health conditions. It's important for everybody to understand that this virus will continue to spread in our community, very likely for months and months. Continuing your awareness of this fact is critical. However, it shouldn't mean that we need to be shut away in our homes. It shouldn't mean that our businesses need to be closed. It shouldn't mean that our children can't return to school or participate in sports. This is something we're going to be living with. We need to continue to be vigilant and make good health choices. Washing your hands, not touching your eyes, nose, and mouth with your hands and fingers, keeping surfaces clean and disinfected, staying away from others that are sick, and staying away from others when you're sick. And it needs to be said, good health is also about good nutrition and getting exercise and fresh air and sleep and not smoking. These are all things that public health leaders all across our country, here locally, across the world, talk about every day, during a pandemic or not, and it needs to be said. These things matter now more than ever. If you're 65 and up, or you are someone with an underlying health condition, you need to be the most vigilant of all of us during this pandemic right now. Weeks ago, the county pivoted to a priority focus on vaccine distribution and administration, with the goal of standing up as much capacity here in our community as we can to get doses of the vaccine into the arms of the residents who need it and who want it. As the virus continues to make its way through our community, these vaccines are going to help prevent severe health complications, hospitalizations, and death for those in our community who are most vulnerable after contracting the virus. This is why through today and over the last few initial weeks of the vaccine rollout, where we've been receiving only very limited quantities, to Ms. Kerrigan's point, of the vaccine, we've prioritized frontline hospital workers and those 65 and up. It's continued to be all about hospital capacity, and the residents in our population with the highest propensity for winding up there and who are at risk of death are those 65 and up. With each passing week, we are pleased to see increases in vaccine allocation coming from the state. It's progress, and we thank them. State public health officials have let us know that doses being sent to Kern County for next week is more supply than we've been given in any week to date. Again, this is progress, and we thank them. We're pleased with the progress we're making to stand up 3 state-run vaccination sites in the communities of Rosamond, Arvin, and Wasco. Ms. Kerrigan talked about them. These additional sites will bring with them 2,000 additional doses of vaccine every week for residents of Kern County, and particularly residents and folks in those communities. This is on top of the allocation that we're receiving, so we're building supply. As Ms. Kerrigan stated, beginning next week, the state will be taking control of all appointment scheduling through its My Turn registration process. Kern County is among a handful of counties in the state that has been selected to get this system up and running in the state's first phase launch. We're grateful. They'll have complete control over who can provide the shots, how many shots are made available to those providers, and who is going to be eligible to receive those shots from those providers. That's all going to be managed through this system, and that starts next week. Now, this system needs to work. We need to get this vaccine to as many in our population who will take it. And Governor, we need to get more vaccine to our teachers. We need to get more vaccine to our first responders. We need to get it to our ag workers. And we need to continue to have enough to get it to the vulnerable 65 and older population and those with pre-existing health conditions. We shouldn't have to make choices on who gets these vaccines among these very important groups of people in our community. We need more vaccine here in Kern County, tens of thousands of more doses every week than is currently being sent. We currently have the capacity, as Ms. Kerrigan pointed out, to administer at least 45,000 doses, at least 45,000 doses of vaccine every week here in Kern County. That's 180,000 doses every month. It's 1 million doses over 6 months. Our population's 1 million. We currently have the capacity to do this. And Governor, we know that you've got a tough job, but help us help you. Help us help you. Come to Kern County. Take a look at our facilities. Take a look at the capacity we have. I know you're in Alameda County today. Talk to our community. Talk to our teachers. Talk to our ag workers. If you can make it, please bring with you the supplies of vaccine that we need to administer to those groups. Fresno and Los Angeles are not the only places with ag workers and teachers who need the shot. Bringing in thousands of additional federal supplies of vaccine to those areas doesn't help our population. I know that they need it, and it's wonderful that they're getting it, but it doesn't help Kern County residents. It doesn't help our teachers, and it's not helping our farm workers in the second highest producing ag county in the United States. You're setting up mass vaccination sites in other areas of California in partnership with the additional doses from FEMA. We've already done that work here, Governor, and we have a mass vaccination site. We've done the work, it's set up right here in Kern County, and we're capable of administering at least 5,000 doses every single day to our residents, to those groups, if we had the doses. That's 35,000 doses in the arms of people who want it every single week at this site alone. Now, I know managing through this crisis is difficult, and I know the state has an extraordinary task in dealing with it. We are grateful that on the supply side, things seem to be improving, but at the end of the day, we've got to get it right, and we simply need to get much more supply here in Kern County. And ladies and gentlemen, we've only just begun this vaccination effort. We've been doing it just a few weeks now. This is going to go on for months and months. I understand that there is a demand from our public for this vaccine. We understand that many of you want to be vaccinated right now. We've been doing our best to get this work done with the limited supplies we've been given. Things will improve. Supplies will increase. The list of those who are eligible to receive the vaccine will expand. There will be an appointment, a vaccine, and a place for you. Please hang in there. Please stay safe. And thank you, everybody. Thank you for your continued support, your patience, as we deal with really the extraordinary work that's required to get this vaccine into the arms of those who want it. And with that, I'll ask Allie to come back up. Thank you.
All right, now we'd like to open the floor to all of our media partners who have called in. I'll be asking for you to unmute your lines when your news organization is called by name. All you have to do is press *6 and we'll get this thing going. All right, first off, Valley Public Radio.
Hi, good morning. This is Carrie Klein here. I wanted to ask some more specifics about the county's vaccine allocation. So as far as I understand, the allocation from the state is based on a proportion of the county's population that are healthcare workers and those over 65. I was wondering if you actually know what the exact number is, like I'm guessing around 1.5 or 2% of the state's allocation. I was wondering if that still is if that is how they're being allocated right now, and I was wondering what your thoughts are on the fairness of that, to get the allocation based on those populations only.
Bryn's going to come answer your question.
Good morning, Carrie. So initially when we started receiving vaccine, it was based off of the healthcare worker population within Kern County. That had Kern County receiving 1.3% of the state's vaccine supply. It then changed to include healthcare workers and our proportion of population that was 65 and older. And that changed our allocation to 1.6% of what the state was handing out. And then for next week, our allocation changes to be the proportion of population that's age 65 and older, and then those that are employed within Phase 1B Tier 1, which is now eligible starting next week. We need more. We absolutely need more. It's not enough to vaccinate our community, so we just continue to advocate for more, but that's how the allocation is broken up.
And do you happen to know what that percentage will be then once you factor in Phase 1B Tier 1?
So the percentage when they factor in Phase 1B Tier 1 becomes 2.89%.
Okay, thank you.
Telemundo. Is Telemundo on the line? All right, I'll be moving things down to KNZR. Channel 23.
Hi, this is Alex Doherty with 23 ABC. I have a question regarding vaccine chasers. And for those who don't know, those are people who are ineligible at this time to receive the vaccine and are banking on people not showing up for their appointments or leftover vaccines at the end of the day in hopes that they can go and get vaccinated themselves. At this time, at any of our Kern County vaccine locations, is that something that employees are seeing?
No, we are not giving out vaccines at the end of the day to vaccine chasers. Our vaccines are going to those that are eligible, 65 years and older, or our frontline healthcare workers as expected. So if anyone out there thinks that they could potentially get the vaccine by lingering around the fairgrounds or hoping to catch that at the end of the day, that is not an option here in Kern County.
And is there any data that is kept on how many vaccines are thrown away after their shelf life has expired?
I'm going to bring Bryn up to answer that question for you.
Good morning. It is data that is reported to the CDC regularly.
And is that able for public access, the public to see?
Unfortunately, we don't have access to that data locally. It's all reported to the CDC, and to our knowledge, they do not have it available publicly at this time.
Got it. Thank you.
Thank you. Next is KUZZ.
Hi, Allie. It's Rob from KUZZ. My question is for Ryan, and I want to know if we've seen the governor popping up all over the state, setting up these mass vaccination sites. Has the state at all been receptive to our pleas for more vaccines and just more assistance from the state? Or is Kern just kind of like another voice yelling out for more vaccines like every other county?
Kern is a voice among most counties yelling out for more vaccine. I will say that to the state's credit, they are working with us in certain areas to increase supply. As I noted, they announced just this week a supply that we're going to be getting next week that is several thousand more doses than we have received in any week in the past since we started this. We've only been at this again for just a handful of weeks. We are pleased with the state's effort to come into Kern County to set up state-run sites in Wasco and Rosamond and in Arvin. Our role in that is getting a facility squared away that they can use, whether it's a county facility or some other facility, and they bring in the workers and the additional doses. Again, that's going to bring in an additional 2,000 doses every week, but it's just not enough, and I think that's our point. We need more vaccine here. We've got the demand. We don't have enough to meet the current demand in the vulnerable population of 65 and up. As it stands now, we have teachers and ag workers and first responders who want to get this shot, and they deserve to get this shot. It's important that they get this shot, but the supplies limit our ability and their ability to get these vaccines. So we need tens of thousands of more doses a week. We have the capacity again to do at least 45,000 doses every single week. If you do the math on that, we could pretty much get through a vaccination rollout in our community that is super effective and will be meaningful. So it's all about the doses and the supply. I think that the administration in Sacramento is listening and hearing counties. We're not alone. All counties are asking for this. We appreciate the complexity and the difficulty that they face in having to manage through this, just like we are. But at the end of the day, we need more doses, and that's the bottom line. So that's what we're asking the state for, and we need them right away. And again, the governor has been around different parts of the state. He's in Alameda. I think they're doing a press conference right now. They started at 10 in Alameda County. We'd like the governor to come to Kern County, meet our teachers and farm workers, our first responders, our 65 and up, talk a little bit to them, find out what their concerns and needs are. We'd like to show him what we have the ability to do here, how we're set up. We've got a mass vaccination site. We don't need him to come in and do that here. We've done it already, and it's been stood up for the last several weeks. So we need more doses, and that's our message to the state.
Does our infrastructure, is it setting us apart from other counties? Our capacity and ability to administer vaccines?
Yeah, I think that you could probably, I haven't done all that research, but I think, the bottom line is that we didn't wait around for the state to come in and set up a site here. We did it on our own. We didn't wait for the state's registration system to come online here in Kern County. It's only coming online next week. We didn't wait for that. We decided to get out in front of this early on, weeks ago, doing the work, squaring away hundreds of county workers, getting them assigned out at the fairgrounds, repaving and reconstructing an entire parking area to become a 14-lane mass vaccination drive-through site. We've squared away and done the work and made the investments in squaring and planning and getting a mass walk-up site done. We've been vaccinating hundreds and hundreds of people a week out at that site. People are grateful, but we did that early on, and we did it early on because we knew that it was going to be required. We wanted to get ahead of it, but we need the doses. We need the doses out there. We are low in doses based on the capacity we have out there. So in terms of comparing ourselves to other counties, I can only say that we did the work early. We're ready to go, and we got to get the supply in here.
All right, thank you.
All right, next is Channel 29.
Hi, Allie. This is Erin with Channel 29. So one question we have is, I know just briefly mentioned that we still need to vaccinate our ag workers 65 plus, as well as our frontline workers and teachers. And at the rate we're going, it's going to take us a while since we don't have the adequate supplies. When do you all anticipate us being able to vaccinate the majority of those workers and possibly having us move into the next tier of vaccinations and then possibly opening it up to everyone in the county?
Okay, so we are looking up all of the stats right now, but I want to circle back to what Ryan was saying about our infrastructure and a point that he hit on, that we could be doing 45,000 doses a week. And doing the math, that means essentially our entire county could be vaccinated in 6 months. So I think that's a very important message to communicate to our residents that we have invested in setting up sites to get this done. We all want to return to normal life. We want our weddings and we want to hug our relatives. So that is really why we're here today, to talk about the vaccine, explain to our community that we are here and we are ready to administer it. And really, it's up to the state to get those doses to us, which bleeds into your question, Erin, as well. So while Bryn is looking up those stats with our lead epidemiologist, Kim Hernandez, let us research that a little more for you. Is there anything else that you may have on your mind?
Yeah, one other question that I do have is that we just saw the California OK's all outdoor youth sports in the counties with COVID-19 case rates at or below 14 per 100,000 people. Now, I know Kern isn't quite there yet, but it's some promising news. Just kind of asking, when do you all think that we can meet that criteria as a data? Would that happen within the next few weeks, or maybe a month or so? Just any sort of timeline on that.
Okay, Bryn is ready for you.
Perfect.
Good morning. So based on our calculation, if we continue to receive vaccine at the rate that we anticipate receiving it starting next week, it'll take us 48 more weeks to vaccinate that population, those that are eligible starting next week. And then I believe you had a question about youth sports. The governor is releasing new information on youth sports that's effective next week. So we have to take some time to review that, and then we should be able to provide more information shortly.
All righty, thank you.
Thank you, Erin. Up next is the Bakersfield Californian.
Hello, Allie. This is Sam with the Bakersfield Californian. I had a question about the state taking over the vaccine distribution here in Kern County. I'm wondering, is this going to replace the number that people were calling to sign up for vaccines? And secondly, does this mean that for any site in Kern County they have to use My Turn, or can people still call individual distributors like a pharmacy or something like that if they want to get the vaccines?
Bryn's going to get this one.
Good morning, Sam. So yes, starting next week, there is a new phone number for people to call to get vaccinated at the fairgrounds. They can either visit myturn.ca.gov to schedule an appointment, or they can call the state's call center for My Turn. That phone number is 833-422-4255. I mentioned earlier that we are becoming part of this third-party administrators vaccine network starting next week. Kern County Fairgrounds is the first site to onboard My Turn. It is a requirement to be a part of this vaccination network that you onboard My Turn. So the remainder of our providers do have to onboard My Turn. Eventually, all of our vaccination providers will be on My Turn, and it will be a one-stop shop for our residents to go to find out for where there's available appointments and who is eligible. All of our providers will not be on My Turn next week. However, that should happen very shortly.
And then just my follow-up is just why is this happening in general? Is this something that's part of a statewide plan eventually to get everybody in the whole state using My Turn, or was there some other thing that was special to Kern County, which is why we're sort of the first ones to do it?
No, we're actually part of the first wave. So there's a handful of other counties that are also onboarding into this new third-party administrator system starting next week, as well as onboarding My Turn in this first wave as well. There are 3 total waves that will get the entire state both into this third-party administrators vaccine network and onto My Turn software.
All righty, thank you.
Okay, Channel 17.
Hey, good morning, everybody. Eitan Wallace here. First, I will say congratulations, Ali Triolo and Bryn Kerrigan, on your new roles, and certainly look forward to working with you in the future. And one other side note here is that Telemundo, our sister station, was disconnected, and they are calling back. Just wanted to make that clear there. Just a question for Bryn, I believe, is in terms of the appointments. First of all, will My Turn, do I have to wait until Monday to sign up with My Turn, or can those in the next year start making appointments today?
Good morning. My Turn is actually already available. However, our clinic has not been released yet in the My Turn software. That will be available starting Sunday at 9 a.m. But our residents can already visit My Turn, and they can look to see whether or not they're eligible, and they can sign up for notifications. They'll be notified when their group is eligible for vaccination, and they'll also be notified when there are available appointments in the system.
Excellent. And you know, Bryn, you were mentioning earlier that, and Ryan was talking about this, there's to add to complexities here, even though the state memo that you said that the next tier should theoretically be able to sign up with My Turn beginning next week. You're saying right now My Turn is not necessarily set up that way, or they haven't implemented that, to add to some of the confusion here. Is that correct?
That's correct. So according to the state's memo, those that are in that Phase 1B Tier 1, or education, child care, ag and food workers, and emergency services workers are eligible for vaccination statewide. However, My Turn software requires you to go through a drop-down menu that says what group you actually fall in. So if you're an educator, you'll choose that you're an educator. The system right now says that you are not currently eligible for vaccination. So there's a disconnect between the memo and the direction that the state gave us for who is eligible for vaccine starting next week, and what My Turn is considering as eligible groups at this time.
All righty. Well, I think the final question for me here is just about the state rollout. I know that Ryan was talking about an invitation really to have the governor come down here to Kern County. Is the rollout, the slower rollout, I know you said you don't have the doses you need right now, is that from the state, and what about the federal government? Any talks with the Biden administration or the federal government in general, or is it mainly the state administration you're in touch with?
Bryn will be right up.
Good morning. So our contact is with the state because all of our vaccine allotment comes directly through CDPH. They determine the allotment per county, and so all of our discussions go to the state level at this time.
Thank you so much.
And just for all of our media that's on the line, we want to let you know a little bit later this afternoon, we'll be sending out some more detailed information, breaking down My Turn and how the system will actually be working here locally. So hopefully that will help provide some clarity as we all sort through this new change here. All right, let's go to El Popular. Okay, Kern Radio. Kern Soul. Mojave Desert News. And lastly, Mountain Enterprise. Okay, so I know that Telemundo was disconnected. If you are back on the line, please ask your questions now. And again, if any of you need to know how to unmute, just press *6.
Yes, you can hear us now, right?
Yes.
Okay, so I'm Norma Gaspar, but I also have here Jose Gaspar, and he has a few questions. And this is all related to the allocation of the vaccines that are going to go to the farm workers, okay? So who can answer questions about that process?
We'll bring Bryn up.
Okay.
You can go ahead and ask your question, and then she'll come on up.
Okay, so 30% of the total of vaccine allocation is going to go to farm workers and teachers and some other workers beginning next week, correct? How many vaccines are we talking about for farm workers?
1 second, please.
Good morning. So around 4,500 doses of our allocation for next week will be allocated for this 30% split that's going to be directly given to those phase 1B tier 1 populations. There is no split between how much of that 30% is given to each of those individual sectors. The guidance from the state requires that 30% of our total allotment goes to all of those sectors combined.
If I'm understanding you correctly, you're saying that farm workers and everybody else in this group will have a total allotment of 4,500 vaccines, correct, for everybody?
That is correct. That is the direction that has been given from the state.
Okay, one more question. I know that other counties, especially Fresno County, its public health department, about 3 weeks ago, allotted 3,000 vaccines for farm workers in Fresno County. Why did Kern County Public Health not do the same? It seems to be a priority of prioritizing, given that farm workers and this population is amongst the highest risk of contracting COVID. And as the Latino 19 Task Force has pointed out, most of the deaths here in Kern County are Latinos. Wouldn't it make more sense to have prioritized farm workers first, being that they're the ones that live in the conditions that spread COVID more easily than the rest of the population? Why didn't Kern County Public Health do that?
So Kern County followed the direction that was given from the state. The state is the one that issued that COVID-19 vaccination plan that prioritized populations based on what they consider were the riskiest populations for their transmission of COVID-19. They deemed that healthcare workers were in the riskiest positions, and then on January 13th, the governor proclaimed that 65 and older should be prioritized and vaccinated following those healthcare workers. So we continue to follow that guidance, and their direction after that was once supply allows and the demand has subsided in those existing eligible groups, that we could move on. We feel that educators, ag workers, all of those populations are extremely important to us. We want to get them vaccinated. However, the supply that we're getting from the state is just not enough to keep up with the demand that's there.
All right, but then how come Fresno County did it? They took 3,000 and said, we feel they're important, and we're setting aside 3,000. So it seems to me a matter of priority. It appears that Kern County Public Health did not prioritize farm workers, given the fact that other counties were doing it. Why not you?
I'm going to answer that question. I think what Bren is saying is that we have been following the state's instructions and guidelines and guidance on how to administer vaccines. The state has told us that those most at risk in our community from being hospitalized or having severe reactions or complications due to their age or pre-existing condition, that is where we were to prioritize vaccine distribution and administration. The county has been receiving a small amount, a limited amount of vaccine supply for the last several weeks that we've been at this. That supply, based on the state guidance, has been going to frontline hospital workers, healthcare workers, and those 65 and up, due to the risk for those 65 and up. What is different about Fresno is the governor went into Fresno and set up a mass vaccination site and got a bunch of thousands of additional doses from FEMA on top of anything else that Fresno already had, and took the opportunity in doing that to give some of those doses up there. And I can't confirm whether it was 3,000 or not, but that is the situation up in Fresno. That has not happened in other counties, to my knowledge. There has been mass vaccination sites set up in Los Angeles, at Cal State Los Angeles or Northridge, one of them, which is being bolstered by supplies coming in from FEMA. This is a partnership with FEMA that are bringing in additional doses there. That has not happened here in Kern County. And what we're saying is that we have been focused on administering this vaccine to the people who have been winding up in our hospitals and who are dying. And while, yes, the Hispanic population has been hit hardest as a demographic by this particular virus, the people who are being hospitalized for long-term care and with major complications and who are dying are those 65 and up, whether they're Hispanic or white or black or whoever. So that's where we've prioritized. What we're saying is we want to get this vaccine out to as many of these sectors as possible. Ag workers are important to us. Teachers are important to us. We need more supply in order to do that, and supply is ramping up. We've only been at this just a few weeks, so as supply ramps up, as the state delivers more supplies into Kern County, those groups are going to receive this vaccine. They're eligible to, and again, the state's going to be controlling eligibility, dosage, supply, starting next week. We have no call in that starting next week. It's going to be up to the state. And that's where we are, Jose. And so I hope that clarifies things a little bit for you.
Yeah, it does. Thank you for pointing that out. Just one final comment. So then, being that Fresno County had the political pull to get the governor down there and do this with FEMA, do you think there's a lack of political will here in Kern County amongst our county leaders for not doing the same, for not going up to Sacramento and saying, hey, governor, you need to do the same down here in Kern County? You know, it doesn't feel good to say, hey, you know, Fresno County has a political pull, and here it appears that our political leaders, and I don't know if you guys have been pressuring them to pressure the governor to do the same here for Kern County.
I'm going to answer this, and I think we're going to move on to other people, but I don't think it has anything to do with political will or political pressure or political strength. I don't know why the governor was in Fresno. That's where he picked to go. I don't know why he went down to Los Angeles. Maybe he thought those were two communities that were important to land in, to put a mass vaccination site in. I don't know what calculations went into that. But I can tell you, as a county administrator here, along with all the other county administrators up and down this state, along with the California State Association of Counties and their leadership that's made up of supervisors from all counties all over the state, we have been asking for more doses. It's as simple as that. We're asking for more supply. We need more supply. That's where we are. And they're controlling the supply. Jose, we have the ability to provide at least 45,000 doses. It's 45,000 human beings from all the sectors and the groups of people that are eligible to receive the vaccine. We have the ability to do that every single week right now. We're ready to go. We're ready to field those people, whether it's at the fairgrounds or any other place that we have capacity or wherever we're administering these vaccines. So we're ready to go. It's about doses. So that's where we're at. It's as simple as that, and I hope that answers your question. Thank you.
Let me just jump in really quick before we move on. I just have one thing to point out, okay? So beginning next week, everybody's going to have to sign up to myturn.ca.gov, correct?
Correct.
Okay, I just got on that page. Only one portion is in Spanish, okay? Only the one that gives like general instructions. It tells you to press other buttons for other information. Everything is in English. There's one first thing that I wanted to point out. Okay, also, the schedules for the vaccinations, are they going to remain the same from 10 to 4 as they are right now?
Okay, so first of all, let's address everything that's happening when it comes to this transition to My Turn. As a county, you guys know I love ag. I love our farm workers. My sister's a teacher. We want to vaccinate everyone in Kern County. But at the end of the day, we are a county at the mercy of a state. So that is why Ryan, Bryn, myself, we're here asking the state for more doses. Now, the My Turn software, we didn't create that. That was made by the state. So whether or not the translation is there upon that website, that again is a state issue. Our hands are off as far as it goes for next week. We didn't make the site. The governor is in control of the vaccine doses, who's getting it, and how they're getting it. Now, we have the capacity to roll out vaccines 12 days a week. But as far as the scheduling goes for vaccines at the fairgrounds, that's going to be dependent upon how many doses we get. Right now, we've been running Wednesday to Saturday, but again, that is dependent upon the amount of doses that we get. Is there anything else that you guys would like to add? Okay. Excellent.
Yes, that's not, okay. The reason that I was asking about the schedule is because right now it's been 10 to 4, okay, which does not allow to farm workers, to go get a vaccine because their schedule is, it doesn't end. It begins much earlier and it ends much later, and it's 6 days a week. So that's one thing. And the other thing is, transportation, and basically it's not easy for them to just miss work or be late or ask for time off to go get vaccinated. And by the time, the appointments run out so quickly, they're announced one day, the next day, there's no appointments available. So it's very, very difficult for them to, one, get an appointment. Second, get to the place where the vaccines are being provided. And third, there's a schedules. It's not
absolutely.
10 to 4.
So I hear your concern about this community, and I agree it is difficult for them to take time off work. That's not within their typical operating procedure. So as a county, thanks to Lee Jameson donating $10,000, we are instating a transportation service and actually working on that to run on weekends. A week in advance, we will be scheduling individuals for their vaccine, giving them a week's notice, and hopefully doing that on weekends, not only to accommodate our seniors 65 and up, or our access and functional needs individuals, but also our farm workers. So we will circle back to this transportation service once all of the details are hammered out, because as a county, we will not put anything out to the public until it's ready. So.
Okay, we're going on rather long here, and I just want to step in and just say a couple of things. to Telemundo. As we go forward, we continue to build capacity. We are bringing online to that capacity options for mobile clinics. We brought one online that can be used anywhere in this county. It's a partnership that we have with Adventist Health to Hatchb. Right now, that particular mobile clinic is hitting rural areas in the east part of the county, but that clinic can be moved and applied at any place in the county. We have plans to do more on the mobile side as we go forward. But again, the state's going to be controlling the doses, who's eligible, et cetera. I can tell you that today, as we speak, the wonderful company has been given a direct allocation of vaccines from the state. As of yesterday, I think they had 500 doses that they are in the process of administering to their ag workers. So ag workers are not being wholly left out here. There are efforts being made as we speak, vaccines being given as we speak to ag workers, but that is only going to improve as we get more doses coming into Kern County and we continue to build capacity. So with that, we're going to move along, and I'm going to bring Allie back up here.
Thank you all so much for all of your questions today. Before we close out, is there anything else that any of you would like to ask? Okay, so this will conclude.
So this is Carrie Klein with Valley Public Radio. Can I ask one more?
Yes, this will be our final question.
Okay, thank you. I was wondering if any of the county's vaccine supply has been held up by any of the severe weather around the U.S.
Hi, Carrie. Yes, actually it has. All of our doses for last week were held up because of weather.
How many doses is that?
Around 6,000 doses.
Oh, wow. And so is that going to affect any of the clinics or appointments that are already set up for next week?
So some of the appointments had to be canceled and rescheduled. It's sort of a moving target. Some of our providers wait until they receive their vaccines on hand before they start opening up those appointments. It all depends on that provider.
Okay, thank you.
Thank you so much for joining us for today's COVID-19 press briefing. For updated information on all that we talked about, please visit our website at kerncounty.com. Thank you.
To her husband Ryan, or excuse me, her husband